Hello everyone, welcome to the channel Pharmafocus. I hope you guys are doing really great. And I'm back with another video. This is going to be a really short one, but a useful one for someone who is trying to practice. So this is related to the literature sources of pharmacovigilance as I discussed in my previous video. So I'm going to discuss in very short about how you can assess for the adverse event or how you need to interpret things from a literature point of view. So let's start with it. So as you can see this thing, so this is the Vancouver style in which it is presented. So we have the title here, nimesulide-induced acute hepatitis, which gives us a point of view that this is regarding the drug nimesulide, which is a non-steroidal anti-inflammatory drug, and induced acute hepatitis gives us the adverse event that has been induced after taking the drug. So the other thing that is mentioned here is the DOI, which is the digital object identifier. And a digital object identifier is a unique identifier which is basically assigned to the digital content such as any journal, articles, books, etc., which provides the permanent web address for that content. So it just ensures that the work can be easily retrieved and cited, which is helpful in any kind of academic research. All right. So if we look at the abstract of this, then firstly we have here the objective, that is to report the occurrence of nimesulide-induced acute hepatitis confirmed by biopsy and in vitro lymphocyte toxicity assay. So again, what we are talking about here is the induced acute hepatitis, which is due to the drug nimesulide, and it is confirmed by biopsy and in vitro lymphocyte toxicity assay. Now, if we look at the case summary, what things we can interpret from here, we need to look at that. We have a 54-year-old Arabic woman. So 54-year-old is first information. Second one, the woman is Arabic. Apart from that, it is treated with nimesulide, which is the drug for chronic low back pain, which is the indication for which the drug was taken, and was admitted to the hospital. So there is hospitalization as well, with acute hepatitis confirmed by biopsy. So biopsy is something which is used to confirm the adverse event that has occurred, which is acute hepatitis. Now her liver function test results returned to normal within 1 month after nimesulide discontinuation. So what we call this term in pharmacovigilance is there is a discontinuation of nimesulide, which means there is a D challenge, and that D challenge here is a positive D challenge because after the discontinuation of the particular drug, that is nimesulide, the person has returned to the normal result reports. So this signifies that there is a positive D challenge. Next up, we have an in vitro lymphocyte toxicity assay confirmed that the liver injury was due to the nimesulide exposure. So this was used for the confirmation that the liver injury was due to the nimesulide exposure. That is, the drug was involved in the liver injury. So that is confirmed here. Now, if we talk about the discussion, it is about that in general, this case shows us that nimesulide being a new, what is mentioned here, nimesulide, a relatively new non-steroidal anti-inflammatory drug commonly used in Europe with a relative selectivity to cyclooxygenase type 2, can cause a wide variety of liver injuries from mild abnormal liver function to severe liver injuries. So this is regarding that nimesulide, like any other anti-inflammatory medicines, it can sometimes damage the liver, and nimesulide can cause liver injury ranging from mild changes in liver test to severe and sometimes fatal liver failures. So in most of the cases, the stopping the drug, it leads to recovery, is what is interpreted from this case. Again, the conclusion has the drug induced acute hepatitis is a well recognized adverse effect of many drugs, including nimesulide. So, this is a well recognized adverse effect of such drugs. Identification of a drug as a cause for life threatening disease is important because discontinuation of it may be life saving. And this article confirms the occurrence of nimesulide induced hepatitis. It also highlights the importance of monitoring liver function test results after initiating the therapy with such drug. So, what we talk about here is acute hepatitis, which is due to a non-steroidal anti-inflammatory drug, that is nimesulide, and it is confirmed by biopsy and in vitro lymphocyte toxicity assay. So that is what we interpret from here. So if you go through any such articles, you need to analyze that whether the drug was linked to the adverse effect that is reported. You can look for the information. When you read it, you can look for the information, look for the adverse effects, and try to figure out what data is useful if you're processing an ICSR. So that will be really helpful for building a skill, that is reading out the literature articles, the any kind of literature that will help you in upgrading yourself, and it will help you thereby in building up the skills for PVA as well. So I hope you guys like the video. If you want such more videos, do give it a thumbs up and keep watching. Stay tuned. All the best. Thank you.